The first COVID-19 vaccines have begun to be distributed across the globe, and people are eager to get back to some form of normalcy. So as you're probably wondering, when can we stop wearing face masks? The emergence of vaccines is considered by many to be a light at the end of the tunnel. Nevertheless, top infectious disease experts do not want you throwing out your masks just yet. Surges in coronavirus cases, the amount of time it will take to vaccinate a significant portion of the population, and questions about the vaccine's long-term effectiveness will keep us from approaching normality anytime soon. The pandemic is not over, so here is what you need to know about the future of mask wearing. Both the World Health Organization and the Centers for Disease Control and Prevention have stated that masks are an essential element in the fight to suppress the transmission of COVID-19 and save lives. There is a great deal of evidence supporting the efficacy of masks. In a recent study published by the healthcare journal Health Affairs, researchers in the United States found that issuing mask mandates slowed down the growth rate of COVID-19 cases. In a speech this past December, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, shared that social distancing and mask wearing will likely continue several months into the second half and beyond of 2021. Here are a few reasons why. One reason pointed out by physician and biodefense expert Dr. Mark Kortepeter is that getting vaccines out to the public will likely take some time. This is because of the difficulties in vaccine supply chains and logistics. Mass immunization requires extraordinary amounts of communication, technical planning, and coordination. According to the World Economic Forum, factors ranging from vaccine package size to proper transportation can all impact the rollout of the vaccine. Two of the first vaccines approved, the Pfizer-BioNTech and Moderna vaccines, need to be kept at very low temperatures during transportation and storage, or they could lose their effectiveness. The maintenance of a cold chain to allow this could be a substantial hurdle to the timely and efficient distribution of these vaccines. Moreover, not everyone will have access to vaccines at the same time. Government officials are working on ways to ensure that vulnerable populations, essential workers, and frontline healthcare workers are the first to receive the vaccine. Regardless, mass vaccination is likely to take many months or even longer. Varying vaccine effectiveness will also play a role in continued mask wearing. Some vaccines may offer better protection than others. In the U.S., the FDA has stated that in order to be approved for licensing, the minimum required Phase 3 efficacy should be at least 50% in the vaccine group versus the placebo group. This means that in controlled studies, 50% fewer of those who received the vaccine became ill compared to the control group. Thankfully, both Pfizer-BioNTech and Moderna vaccines have a greater than 90% efficacy rate. Next, researchers are still not entirely sure if the vaccines currently available will prevent someone from spreading COVID-19 to others. Dr. Leana Wen, professor at George Washington University Milken Institute School of Public Health, believes that someone can get a vaccine and still be an asymptomatic carrier. According to Dr. Wen, the vaccine will help protect you from getting ill and ending up hospitalized, but it's possible that you could still carry the virus and be contagious to others. Finally, we do not know the duration of vaccine protection. The speed at which the vaccines have been developed is historic, but according to Dr. Mark Kortepeter, it could take months to years to fully understand the long-term effectiveness of the vaccines. In short, we are not sure how long the vaccines will protect us from the evolving COVID-19 strains. Mask wearing will still be a vital part of the preventative measures used to slow the spread of COVID-19. It is likely that you will continue to see masks on the street at events, in restaurants, and at work beyond 2021. In the past, pandemics and air pollution in Asia resulted in a cultural shift whereby people began to regularly wear masks in public. We could eventually see something similar take place globally over the next couple of years. The good news? Mass vaccination is coming, with the leading vaccines currently available shown to be effective at preventing COVID-19. When do you think we will stop wearing masks?